Good morning to all. So in this video we will discuss about the dental amalgam. What are dental amalgam? So dental amalgam is a type of alloy in which mercury is one of the components. So mercury is the main component of dental amalgam. And here know one thing, that dental amalgam is nothing but a silver color filling as it contains about 50% of mercury. So basically it is a dental filling material used to fill cavity caused by the tooth decay. Okay, so it is it is a dental filling material. Okay, so here as we know, dentists use dental amalgam, okay, for filling and to seal the cavity and to stop the decay. But here the question arises that as we know it contains mercury, right? So is it safe to put in the patient's mouth? This is the question arises in every one's mind. So as of 2017, the FDA says that amalgam filling are safe for adult and child who are more than of 6 years old. Okay, so FDA says that dental amalgam filling are very much safe. Okay, for the patient more than 6 years old. Okay, and since mercury is the metal that occurs naturally, mercury is a naturally occurring material in the environment, and everyone is exposed to mercury in some forms, like through the air, drinking water, soil or food. So having some contact with mercury is not that much different from the other daily exposure. Okay, means contact with mercury through this amalgam restoration is not that much different from the daily exposure. Okay, but yes, mercury can cause its harmful effect if some of the amount of mercury is ingested, means swallowed by the patient. Okay, so low level of mercury do not causes any adverse effect, but yes, if high level of mercury is ingested by the patient, they can cause several unfavorable symptoms, and they also shows their effect on kidney, brain, liver, lungs and GI tract. So if amalgam ingested in low level, it do not cause any adverse effect, but its high level, it can cause several effects and cause their effect on several organs, several main organs like lungs, liver, brain. Okay, so this is all about the mercury, why we are using mercury in dental amalgam. Now we will discuss about the uses, indication. Okay, so first is our used in class 1, 2 and 5 restoration, used in class 6 restoration, can be used for cuspal restoration and used for making dies. Okay, for making dies and used in retrograde root canal filling. Okay, for core buildup and for restoration that have heavy occlusal contact. Okay, used in restoration that have heavy occlusal contact. Okay, so last point is used in class 3 restoration, means restoration of class 3 in anesthetic area like distal aspect of canine. Okay, now we will talk about the contraindication where we should not use this. Okay, not used in anterior teeth as it is not aesthetic, not used in prominent area of posterior teeth, not used in small class 6 restoration and not used in small class 1 and 2 restoration. So this is all about the contraindication. Now we will talk about the advantages and disadvantages of dental amalgam. So advantages are they are easy to use and easy to manipulate. They are inexpensive, not expensive. They have a very excellent wear resistance. They have good compressive strength. They have a very good sealing ability and they shows very less micro leakage. Okay, so disadvantages are they are non-aesthetic, means they are not of tooth color. Okay, their color is not of tooth color. They can cause tarnishes and corrosion. They have metallic taste. As we know it contains metal, so they have metallic taste. They can cause galvanic shock like electric shock. It is like electric shock. They can cause discoloration of tooth structure and they lack chemical and mechanical adhesion to the tooth surface like enamel and dentine. They can cause mercury toxicity. They can promote, they are promoting plaque adhesion and they can weaken the tooth structure. Now we will talk about the property. First is dimensional change. So if dental amalgam are properly handled, they exhibit a very minor degree of contraction and expansion on hardening. But if excessive contractions are there, they can lead to micro leakage and secondary caries. And excessive expansion can lead to produce pressure on the pulp and also cause sensitivity. And excessive delayed expansion can occur if zinc containing amalgam is contaminated. Okay, so excessive delayed expansion can occur if the zinc containing amalgam is contaminated by the saliva or moisture during the condensation. Okay, now we will talk about the micro leakage. Dental amalgam has a tendency to minimize the micro leakage as it can form the corrosion product like copper and tin. Okay, which forms between the tooth and restoration. Okay, and these prevent the micro leakage. This corrosion product will prevent the micro leakage. And their strength, they have a very good strength, compressive strength, and have a poor tensile strength. Okay, and the thermal property, they have good thermal conductivity, and in this condition pulp should be protected with either varnish, liner or base. So classification based on copper content: low copper alloy and high copper alloy. Low copper alloy contains 6% of copper and high copper alloy contains 6 to 30% of the copper. High copper alloy further divided into admixed alloy and single composition alloy. Now classification based on the zinc content. Okay, there are two types. Zinc containing alloy contain more than 0.01% of zinc, and zinc free alloy contain less than 0.01% of zinc. Okay, so classification based on the shape of alloy particle. Okay, classification based on the shape of alloy particle are lithic cut alloy, silver spherical alloy, and admixed alloy. Okay, these are the classification based on the shape of alloy particle. Then classification based on the number of alloy metal. First is binary alloy. Second is tertiary alloy, and third is our quaternary alloy. Okay, now we will see the classification based on the size of alloy particle. Okay, based on the size of alloy particle, like so as we can see, based on the size of alloy particle are micro cut, fine cut, and coarse cut. Okay, so these are the classification based on the size of alloy particle. So the last classification is based on the presence of noble metal. Okay, so these are of two types: noble metal alloy and non-noble metal alloy. So noble metal alloys such as gold, platinum. Okay, now we will talk about the composition of dental amalgam, what they are composed of. So they are composed of 50% of mercury, 2% of other metal, 8% of copper, 15% of tin, and 25% of silver. So this is the composition of dental amalgam. Talk about the function of each constituent. So first is our silver, which whitens the alloy, decreases creep, increases strength and resistance to the tarnishes. Tin decreases the tarnish and corrosion. So these are the functions of silver and tin. Now we will talk about the function of copper and zinc. So copper increases the hardness and strength and increase the setting reaction, and zinc acts as the deoxidizer, means it acts as the remover of the oxygen, and it also delays the expansion. So in this video, this is all about the dental amalgam. In next part, we will discuss about its setting reaction. Okay, so this is our tooth structure in which we have prepared the cavity. Okay, so in red color In red color, this is our pulp. Okay, so this is our pulp. And in the gray color, this is our dental amalgam restoration, okay, which we have done in the prepared cavity. So as we know, dental amalgam contain mercury, right? And this mercury can irritate the pulp. So we will apply varnish base or liner in between the restoration and the pulp to protect the pulp. So this is all about the pulp protection in between.